Having said that, allow me to say yes, I've been a member of the Education COVID-19 Response Committee, which basically was looking at ways and means of reopening schools after the first wave. And more importantly, we were looking at the safety of the children while in school. A few things had to be proposed and put in place. For example, how do we take care of the children once they reach school? And proposals were given, which I will be sharing with you. Now, what is the government perspective on health of students in schools? Ladies and gentlemen, the government has continued to put money in National Insurance Health Insurance Fund, NHIF, to cater for students while in school through what is popularly referred to as EduAfya. What EduAfya is supposed to do is to ensure that when a child falls sick, this child is taken care of. Here it was believed that, which was correct, that we have some children from very vulnerable homes, and therefore when they fall sick, they would have nobody to take care. So from the capitation that government sends to schools, some money is retained by the Ministry of Education and taken to EduAfya for these purposes. But what have been the challenges with the EduAfya program? Number one, the EduAfya program requires that schools identify a health facility where they would be taking their students whenever they fall sick. This health facility is believed should be closer to the school, where the students can be taken either on foot or the school to look for transport. Initially, it was believed that the health facility would provide means of transport to collect students at school, but this did not take off. So schools are supposed to take these children to hospital when they fall sick, which is a challenge because very little money is left in school to cater for any medical support. And number two, the charge per visit for this student had been predetermined in the negotiations between the Ministry of Education and NHIF. So as the schools, you have no control on what are the charges, and you did not participate. Averagely, any visit to school is charged at a cost of 1,500 shillings. But any extra tests or any extra diagnostic information that is required, let's say an X-ray, some lab test that is required, the school is expected to pay for this, which of course you can see the school didn't have any funds. The funds are retained in the ministry. What comes for insurance is now to take care of insurance of school property, the buildings, the dormitories for boarding schools, and motor vehicles for schools that have motor vehicles. But on medical, it has all gone to NHIF. So when now schools are being asked to pay for X-rays, to pay for certain tests, diagnostics tests that are required, then again that becomes a challenge to the schools. What happens if the school doesn't have money? Then parents have to be called so that they can send that kind of money. And as we are aware, with the current challenges, not all parents will have money as and when the child falls sick. So that has been a very big challenge to schools based on the EduAfya. Again, with the EduAfya, certain ailments are not being handled. For example, when the child has eye infections, those ones are not being handled. Ear and nose, also those ones are not being handled. So you find that should there be a case like that, then the schools have to look for extra funding to do that. And now that becomes money that the school does not have. But the idea was noble to have NHIF come in. But as these students report, the hospital makes claims. And at times you find you are written to as the principal of the school, requiring you to confirm that those costs are correct. And you see, when the child is admitted, let's say in the hospital, you are not aware of the kind of medicine this child is given. So when they make claim and you are supposed to confirm whether the claims are correct, you can only confirm that yes, the child went to hospital on this particular day. So those are some of the challenges that we face with the EduAfya program. But if we look at the concept of health of students in school, and this is what I've been looking at. You look at the old national schools, the likes of Nairobi School, Lenana, and the rest. You discover that those schools had sanatoriums, and the government was able to employ somebody to take care of the children at that point. The children could be accommodated and taken care of within the school setting. So the child could not go out of the school unless it was a case that really required hospitalization in another medical facility. That is the concept that I still believe that as a country we must go for in our schools, especially during this pandemic. It is the same concept that led to us at Machakos School, and I proposed this to the board, that we must look for a health provider that can assist us, because the teachers are not health officers. Teachers have a specific role to play in the life of the students. But you find that these same teachers were being woken up in the night, were being brought cases of sickness to handle, or maybe take to the health center. And with the coronavirus having been there, everybody was scared. So how are these students, when they fall sick, going to be handled? And that is why we looked for a service provider. And we discussed with Heri, and Heri came in. And they have been with us up to now. They are still with us. Now, what was the concept that we wanted? One, we had wanted to do a kind of health facility within the school using containers. So 20 feet containers, where one container would house the observation room, the pharmacy, and the rest, and the other container would house the isolation room with 3 beds, and maybe a place where the nurse taking care of the children would spend a night, and a kitchen where the food for these children would be, that is the kind of outpatient facilities that we are thinking of. That was the concept that we had. We did not manage to reach this level to put it, but it is still in our mind that one time we will have to do that. That's an isolation facility which has 3 beds. From the aerial view, you can see the room on the left, completely on the left, is where the nurse staying overnight would be, with her own or his own toilet facilities, not sharing with the students who are in the isolation, those 4 beds on the right. You can see a point where we have a toilet for them and a bathroom. That was the kind of concept that we were having. But we did not stop there. Because we did not do it, we didn't say that now we can't move on. What did the school do? We had a small place which we used to use as a small clinic with our nurse, which now Heri came in and took over. We established another room within the school that was an isolation room with about 4 beds. And we have continued very well. What we have on a 24-hour basis is a clinical officer, a nurse, and a lab technician. Small tests like malaria tests and what are done within the school. Where we need to do other tests, the samples are collected in the school and the lab technician is able to handle that and get the results. So throughout this period, none of our students has been taken out there to be handled in a public facility. As we know already, there was a scare that in the public facilities, the issue of corona was there. So most of them have been handled within the school. Only very few cases went out, especially those who had sprained their legs after playing in the field, or those who needed an X-ray for the chest or the rest. Those ones went out. And we have continued. Even now, as we are sitting our national exams, we have a student who has been handled within the school. And if it was on any other normal case, these students would have been sitting his exams from a hospital bed somewhere. But throughout the period, he has been in the school, being handled by the clinical officer and the nurses who are here throughout, checking on him. And he has sat his exams within the school premise. And as I speak, he has recovered. He's now very active. And we thank God that we didn't have to take him to a health facility and carry his exams there, which would have been very traumatizing for him, sitting an exam in an atmosphere that is not very used to. So we have 24-hour surveillance of our children and available clinical officer, a nurse, and a lab technician within that period. They will spend the night in the isolation room if it is not occupied, and it has never been occupied, we thank God, but they are available on any case that the students may face. We've had cases where students have had a bout of malaria, being an attack of malaria late in the night, and the other students have been able to bring them to the sick bay, and the nurses and the clinical officers have managed it. In the past, a teacher will have to be woken up and take this child to hospital. So the teachers have been left to handle their core business. Apart from managing issues of discipline when it comes to the use of the facility, they are managing their core business, teaching and learning. And the business of medical issues have been left to the experts. Because with the corona challenge, we needed to have those who have been trained well in managing this pandemic. And I'm sure we've done well. They have done a good job, and we would still wish to see that they continue with us. And it is something I would wish to propose to our schools. I would wish to propose to government to look at the concept of EduAfya and maybe a portion, so that part of this can go to NHIF and part remains in schools, so that the schools can engage with health providers like Heri and any other whom they can negotiate with. And I'm sure Heri, for us, Heri has done a good job. Thank you very much. I hope I'll be able to respond to any questions that will be brought in from members participating. Otherwise, thank you. I hope I've not exceeded my time so much. Thank you very much.